All right, a very special guest joining us this morning, Dr. David Argo from Beacon Orthopedics, here to talk about all things medical. This morning we're talking about physicals, aren't we?
We are.
We got a big round of physicals coming up in the fall for kids who want to play sports. When are you supposed to start having a physical? At what age should you be having a physical before you go play sports?
Well, really, it's from junior high on up.
Junior high.
You ought to have a full physical before you participate in junior high athletics for the school standpoint. But you ought to have a physical once a year anyway with your primary care doctor for their evaluation too.
And why is it so important with physical activities with sports?
Well, you know, there's a lot of things that you can find on these exams where people maybe have a little bit of asthma that's never been diagnosed. Mm-hmm. You want to find that before you get out on the hot summer day and the high humidity and have all the risks that you have with those kind of activities. And have asthma, you could have a little heart condition that maybe it's not diagnosed.
Sure.
Blood pressure problems. We find a lot of kids with high blood pressure these days.
Do you?
Huge amount, and that's something we're trying to address very aggressively with the primary care doctors to try to get those blood pressures back under control.
Right, and it's not a substitute for their physical with a primary care physician,
Not
right?
at all, not at all. This is a pre-participation physical, and there's a very specific form that we fill out both for the Indiana, Kentucky, Ohio. They have their own forms, and we go through and check the requirements of those, and we look at other things too, but it's not a substitute, like you said, for their primary care annual evaluation. You know, there's some female athletes who really need to have, when they get to that 14, 15 years old, they need to have a good primary care physical evaluation and be able to have the dialogue with their doctors about what's important and what's going on in their life, their bodies, and those kind of things. We don't do that.
Sure.
We are pre-participation physicals.
And you guys can help avoid a real embarrassing moment for the parents when they take their child to practice and the coach says can't step on the field because he doesn't have his physical yet. Parent might think, oh, I didn't think you were really serious about that, but then, boy, the son or the daughter feels really upset. So what's the message there?
The message is we offer physicals. We've already done the East Central High School physicals and saw 370-something kids and put them through a real physical. People come. We have 3 different physical dates through the year, and if you don't mind, I can read those for you.
Sure.
We have Batesville, Indiana, and all the surrounding schools at our Batesville office, and the information will be on our website at beaconortho.com. But that is May 27th from 3 to 6. And then at Summit, our facility out in Sharonville, it's on July 25th. And you may want to write these down so that you have them. Because if you miss them, sometimes it's hard to get them caught back up. July 25th from 8 to 12 in the morning. And then our Beacon West office, which is out on Harrison Avenue, is July 29th from 6 to 9 at night. So we've got some in the morning, some in the afternoon, some on the weekends, some in the week. Trying to hit everybody so that we can get as many folks taken care of. And they don't show up at their first practice and the coach says, you can't play.
Yeah, and it's definitely not something that's overkill or superfluous, however you say that word.
Superfluous.
Yes, very good. No wonder you're the doctor. This is definitely something that parents need to do.
Absolutely. And not just to check off the boxes on the form. We do a real physical. Just at East Central, we had nurses checking blood pressures. We had primary care doctors doing heart and lungs. We had ear, nose, and throat doctors doing ear, nose, and throat exams. We had spine surgeons doing spine exams. Orthopedic doctors and physical therapists and athletic trainers doing the physicals of the musculoskeletal system. So it's a real exam. I had plenty of parents come through and say, God, he's never had an exam that thorough.
Sure.
Well, it's not like we had when I was, when I played at Vanderbilt, and we were talking earlier, when I played at Vanderbilt, our physical was you walk in and say, how you doing today? I feel fine. Any problems? Nope. Go on. It's not like that anymore.
Sure. I hear you. Oh, and I remember those days, too. I played down the road.
That's right.
Well, good to see you this morning, Doctor. Thanks for coming in and talking to us about it. And if you'd like more information on Beacon, their doctors, and their services, you can check them out at beaconortho.com. There's a link to the website right on the front page at WLWT.com. You can also reach them at 513-354-3700.